It's automatically going to record. Hello, everybody. Thank you for joining us. We're going to give a couple more minutes to some of the people who have registered, and then we will get started. So just hang tight for a couple more minutes. All right. Hello, good morning, good evening, good afternoon, wherever you are attending today. We're really happy to have you. My name is Lauren Scott, and I'm a Senior Assistant Director at Massachusetts College of Pharmacy and Health Sciences. And I'm really pleased to have you all here today. So thank you for joining us. We are going to take some time to introduce you to our grad pharmacy programs at MCPHS, and we're going to be discussing some of the benefits of our STEM programs and our non-STEM programs, and some of the employability outcomes that come from these. So thank you for registering for this. Thank you for attending. A couple of quick housekeeping notes. You are going to have access to a Q&A, which most of you will find at the bottom of the Zoom screen. Whenever you have questions, please put them in the Q&A section. We have a really great team of panelists today who are going to be happy to answer them. And when we get through presenting all of our information in about 40 or 45 minutes, we're going to take all of your questions and answer them live. And our team will be answering them as we go through the presentation as well. So that's our quick housekeeping. And then besides that, we are going to dive right in. So a little bit about MCPHS before we get into the actual programming piece. Akash, if you could go back, thank you. So MCPHS has been around for 200 years. We are a leading institution in the Boston and Longwood medical area, which we will talk about the Longwood medical area and the benefits that provides you shortly. You will see a map that we'll talk about that. Over our 200 years, MCPHS has really grown into one of the most comprehensive health science universities in the world, and we've able to really cultivate a sense of leadership in this field throughout this time through both our networking and also the outcomes that we've given to our students. And we will also be talking about our collaboration with organizations such as MassBio, which also lean into the leadership role that we play in both the Boston area, but globally in health sciences. And being rooted in this experience, we decided to create this webinar series so that we could help you in asking the right questions. So we know you're going through your university search. Many of you on the call are currently admits or deposits. Some of you are still just playing around with the idea of applying. We want you to walk away from this webinar knowing what questions to ask the universities that you're applying to. So not only MCPHS, but wherever it is that you're looking, and making sure that you're answering the questions that should be keeping you up at night, more than just items like tuition and admissions requirements, which are very important pieces. But there are a lot more items that we want to make sure that you're taking into consideration before attending a program. So our two goals today are definitely to inform you about our graduate pharmacy programs and what kind of job outcomes you can look for in the different fields that you could study in. But it's also to make sure that we give you the opportunity to learn which questions are the most impactful for you. So with that being said, Akash, could you bring me to the next slide, please? Excellent. So today we have our staff panelists listed on this slide. I will save Dr. Kerr for last but not least. Janice, if you could take a moment to introduce yourself.
Hi, it's so nice to be here. Thank you for joining, everyone. My name is Janice Sang, and I'm the Associate Director of International Admission for Transfer and Graduate Applicants.
Thank you, Janice. Hello, everyone. Namaste, Sat Sri Akal. Good morning, good evening, wherever you're from. So my name is Akash, and I'm the Senior Associate Director for Recruitment South Asia. I have been with the university for about 5 years now, and happy to support you in any way I can. Thank you.
Thanks, Akash. And I should have mentioned this before. I do manage our students from Latin America and those who are living in the US who are not US citizens. So now I'd like to introduce our student panelists to you. We have 4 really great students on the call that I think you're going to really appreciate hearing from. They have contributed amazing work to our international office. Many of you may have already actually spoken with some of these students. So without further ado, Miss Neha Patel, could you introduce yourself, please?
Thank you, Lauren. Good morning, everyone. I'm Neha Patel, and I'm an international student from Canada. And currently, I'm pursuing Masters in Regulatory Affairs and Health Sciences, and I'll be graduating this year.
All right, thank you, Neha. Hello, everyone. I'm Shivani Dave. I'm originally from India, and I completed my pharmacy back there. I'm currently pursuing my master's in pharmaceutics, a thesis-based course, and I'm currently working on preparing a novel formulation for skin cancer.
Hello everyone. My name is Alisha Patel, and I'm a final year student from Masters in Pharmaceutics and Drug Design, which is a lab-based thesis program. I'm originally from India, and I completed my Bachelor's of Pharmacy back there. My career goal is to become a pharmaceutical scientist by advancing in research and drug development, and I could contribute to the innovations in medicine. I'm currently working on my thesis project, which is focused on personalized medicine. As we know that hypertension patients are taking multiple medicines to achieve the therapeutic target, and which could result into tablet burden and some poor adherence of the treatment. So I'm currently working to develop a multi-drug tablet which with three antihypertensive drugs which would be of variable doses, and I would formulate that using a 3D printer, which is a step towards personalization and could cause a transition from large scale production of fixed strength medicines towards some individualized therapy. So I'm looking forward to interact with you guys and answer all your questions. Thank you.
Hi everyone, my name is Supi Han and I'm a third-year pharmacy student at MCPHS. I'm gonna graduate this May because our program is a 3-year Accelerated PharmD program, so we can get Doctor of Pharmacy degree in 3 years. I was a medical science liaison at global pharmaceutical companies and always wanted to learn the US treatment landscape because the US is leading this industry. So I searched for a lot of information and I decided to come to MCPHS. So I came to the States to get my PharmD degree, and I'm aiming to return to the industry in the global market. Thank you.
Thank you so much, student panelists. Very glad to have you here. And last but not least, as I promised, Dr. Stephen Kerr. He's currently our Associate Provost for International Affairs here at MCPHS, and he's also a professor of medicinal chemistry. So he comes to us with quite an extensive background, but he has been here for 28 years. I'm very happy to say that, and couldn't be more thankful for his time this morning on this call. He started out as an assistant professor and then moved into various roles while at MCPHS. He's been the Pharmacy Science Department Chair, Senior Associate Dean, and the Interim Dean for the School of Boston Pharmacy Programs. And now he's part of the Provost Office as well. He completed his BS in chemistry from St. Xavier's College, and this was in Mumbai, India, which he then followed up with a BS in technology of pharmaceuticals and fine chemicals from a university many of our Indian students will know, ICT, which is also located in Mumbai, India. After that, he made a jump over to Buffalo, New York, where he did his PhD, and then he followed that with a postdoc at Yale University in Connecticut. So Dr. Kerr, thank you for being here. I'd like to give you a minute to welcome everybody.
So thank you, Lauren, and thank you, panel, for your time, and welcome everybody. We're so happy that you could share some of your time with us today as we outline the different programs that you might be interested in at Mass College of Pharmacy. Thank you, Lauren, for that very flattering introduction. I'm just a regular professor, basically. Stayed in school all my life and ended up in the position that I am right now. So, it was just a regular transition, I should say, of living. But my role actually at the university today is to be responsible and also to be a resource for all our international students. My full title is actually Associate Provost for Academic and International Affairs. So besides international students, I also have some responsibility for all our students at the university, since I am part of the Provost offices, which oversees all of the university academic operations. So as a pharmaceutical scientist, I do have a lot of insight into what MCPHS does, especially in the pharmaceutical sciences, but also being at the college it's now my 28th year here. And I've also had an opportunity to teach in pretty much most of the schools of the colleges of MCPHS. So besides the School of Pharmacy, I've taught in School of Arts and Sciences, I've taught in the PA program, the physician assistant program. And so, and I've been associated also with our Smith program, which is medical imaging and therapeutics. So I do have some insight in pretty much a lot of the programs that the university offers. And I think I am a pretty good resource for all our students, and especially for our international students. So I'm here to take questions. And then, of course, once you matriculate into the university, I'm here as pretty much your resource, and you can come to me for any issues, whether it is academic or other issues. If it cannot be handled at the department or the school level, then of course at the provost level, it will be would be handled appropriately. So thank you again, and thank you, Lauren, for inviting me to be on this panel. And again, thank you all of you who have given us your time to be here today. Thank you.
Thank you, Dr. Kerr. You're ever so humble. And with that, I'll be passing it over to Akash to talk about where we're located.
Sure. Thank you, Lauren. And thank you so much, Dr. Kerr, for your brief introduction. Now, guys, we'll talk about this location. You can see the map of the Boston city. Now, this is the Longwood Medical and Academic Area. This is the place where we have our campus, the Boston campus located. And I'm very proud to say that we are the first higher education institution in the city of Boston. Now, being said this, I would kindly request Dr. Stephen Kerr once again to please start us off by giving some insights about this location and about the job opportunities in this area and beyond.
Thank you, Akash. And those of you who can see the screen, as you can see, we are in this sort of region of the Boston city called the Longwood Medical Area, because most of these institutes that you see are located around Longwood Avenue. So as you can see, besides the major medical institutions, and I don't have I can't use my pointer, but Akash, you can sort of point to the different areas. But if you think where MCPHS is, that is right along Longwood Avenue. And you can see the major medical institutions. At the bottom of the screen is Brigham and Women's Hospital, one of the first hospitals that started off in Boston. At the top of the screen, you see Massachusetts General Hospital, which was actually the first hospital that began, especially in the United States. And then you can see we have other very famous hospitals, Boston's Children's Hospital. We have the Joslin Diabetes Center. We have the Dana-Farber Cancer Institute, the Beth Israel Deaconess Medical Center. And so all of these medical institutions do highly innovative research, but also do highly innovative clinical studies and attend with pretty much cutting edge technology in order to treat their patients. Of course, in order to do this, they are supported with the emerging technologies, which is from a lot of the pharmaceutical companies that are also based in Boston. So you can see right next to Beth Israel Medical Center is Merck. In fact, that's one of the neurological sciences headquarters over there at Merck, where they do a lot of their research and development. And if you go across the river, you can see Pfizer, Biogen, Sanofi, of course, Moderna, you've all heard about because of the COVID vaccine. But there's also Takeda, there's Bristol Myers Squibb, and the list goes on. Basically, it's estimated that we probably have over 500 different pharmaceutical companies in the greater Boston area. I should mention, because of this, there is a lot of research and development. There's a lot of scope for job opportunities. I think recent estimates say that in the next 10 years or so, there's something like 40,000 jobs that will be generated in this area, especially in the pharma, biotech, data science industry. So, this is a hub of research and development. It is a hub for innovative medicine being practiced. And so students who are at MCPHS do get the opportunity to participate in this very vibrant medical and research environment. Thank you.
Thank you, Dr. Kerr. We would now dive into our graduate program offerings, and I would once again request Dr. Kerr to share one or two examples of the jobs that the students can obtain after completing each of these programs.
Thank you again, Akash. So as you can see, MCPHS does have a lot of different programs. I think if we were to count each and every program offered by the different schools, we are probably over 100 different programs, degree programs, and certificate programs. But from a pharmacy or a pharmaceutical point of view, these are our major graduate programs that we have. Pharmaceutics, it is both thesis-based, meaning you would be expected to conduct a research study, put forth a proposal, and then defend that research. We also have a non-thesis track for those of you who may not be that interested in doing research, but still want to get the knowledge based of that particular discipline. Similarly, pharmacology thesis versus non-thesis, medicinal chemistry thesis, non-thesis. We also have the pharmaceutical economics policy, which is pretty much all about how do we analyze, let's say, the expenditures for making interventions in treatment, in medical treatment, and then looking at whether the outcomes were beneficial or made sense. So, for example, if one wants to do a PET scan to look at a brain tumor, how much money did you spend in doing that particular diagnosis? And then what was the benefit for the patient? Did the patient actually get some treatment and survive whatever, 3 months, 1 year, 5 years, so on and so forth. So analyzing the economics around that treatment is what pharmacoeconomics is all about. We also have the reg sciences, which is all about looking at the regulatory environment, where we would have either new drug applications or investigational drugs, or as well as looking at some of the protocols necessary for doing clinical trials. And besides the non-STEM program in regulatory science, we also have a regulatory affairs, the regulatory affairs and health policy, the non-STEM program, but we also have a STEM program in reg sciences, similarly in clinical research and clinical investigation and development. Associated with that, in our School of Arts and Sciences, we have a Master's of Public Health. Getting back to Akash's question regarding the job opportunities, as I mentioned earlier, Boston is a hotbed for the biotech and pharma industry. And as I mentioned, for the next 10 to 15 years, it's estimated at least 40,000 new jobs are supposed to be generated. But I think I should also mention that Mass College of Pharmacy is also very closely associated with the Massachusetts Life Sciences Department and also the Massachusetts Biotechnology Council. In fact, we have received grants from Mass Life Sciences to develop programming so that we can train students and others to be hired in this pharmaceutical and biotech industry. So with that, I can also mention that students working at MCPHS will be able to work on very latest equipment, because we are making new labs to supply a workforce to the pharma industry. They will be working, if you do a research study, you can work with one of the professors and actually develop new knowledge. And you also have a chance to partake in, let's say, certain studies which could be affiliated with some of the industry. So we do have courses that students can take as electives, known as pharmaceutical practicums, where they can actually work from 1 to 2 months in a pharmaceutical industry and get credit for that as well. So based on that, I think in the case of these pharmaceutical sciences, if you think about the jobs, pharmaceutics, as most of you from a pharma discipline would know, is all about drug formulation, drug delivery. How do you optimize delivery of a drug? Pharmacology is actually finding out what is happening to the drug once it gets into the body. So we do have a licensed vivarium where we can do animal studies. Of course, cell culture work is pretty much common practice today. Medicinal chemistry, we have a very state-of-the-art FT-NMR. I think it's a 500 megahertz FT-NMR, if I'm not mistaken. But also we have a LCMS as well that students can learn. So again, looking at some of the latest equipment that is there in the industry. Akash, would you want me to expand anything more, or can we move on?
I think, Dr. Kerr, we can move on. And being said this, guys, as Dr. Kerr has already mentioned, that we are the #1 biotech cluster in the world. I would also request you, Dr. Kerr, if you could throw a little light on our Accelerated PharmD program, if possible.
Sure, thank you. So for those of you basically who would like to, let's say, get a doctor of pharmacy degree in the United States, and keep in mind, the doctor of pharmacy degree in the United States is the only degree that one can have if you want to become licensed as a pharmacist, because the accelerated program, basically in a period of 34 months, you will receive the education as well as the clinical experiences that will qualify you to apply to sit for our North America Pharmacy License Exam, which is the NAPLEX exam. Of course, if you pass the NAPLEX exam, you basically become licensed as a pharmacist. Keep in mind, the NAPLEX exam, there are 2 parts. There's also a jurisprudence exam, which is a law exam based on the particular state that you would like to practice in. But of course, doing the PharmD, the accelerated PharmD, makes you eligible to apply to sit for the NAPLEX. And as I mentioned, once you pass the NAPLEX and pass the jurisprudence exam, the MJPE exam it's called, you will be licensed as a pharmacist, where you can practice as a pharmacist either in a retail setting or in a hospital setting or a clinical setting, or even what we call an ambulatory care setting. All of that you would be able to do because you would be licensed to practice there. You might have heard from one of our panelists, Sophie, who's interested in the pharmaceutical industry. So doing a PharmD, keep in mind, many pharmaceutical companies actually look for pharmacists, whether they're licensed or not. But if they have a doctor of pharmacy degree, pharmaceutical companies like to hire such pharmacists or such students who graduated with a doctor of pharmacy degree in their pharmacovigilance section, in their medical education section, and things like that. And so it is possible to also work in the pharma industry with a PharmD degree. So it is not necessary to have, let's say, a master's in pharmaceutics or pharmacology. You can also have a doctor of pharmacy and get excellent opportunities to work in the pharma industry. I should mention that Mass College of Pharmacy runs a biopharmaceutics fellowship program, where we actually place at least about 100 students who have their PharmD with various different companies in the Boston and along the East Coast. Thank you.
Thank you, Dr. Kerr. Janice, can I please request you to let us know what is this table all about?
Yes, thank you, Akash. So here we have listed our graduate program offerings and their admission requirements. So certain majors are considered STEM, and we want to take a moment to highlight how important this is for students' employability. So all international students are able to work 1 year for their OPT, which stands for Optional Practical Training. If a student completes a STEM designated program, he or she would be able to add an additional 24 months of OPT. So this is valuable time for students to be able to network, gain strong experience on their resumes, and also prove themselves in a company for potential work sponsorship. So in this slide, there are mission requirements for our list of non-lab majors. The programs are 4 semesters long with the possibility of graduating earlier if you're working with your professor to take on an extra load. All programs are charged by per credit. And this list of programs has fall and spring starts. We've listed out the admission requirements. Minimum test scores are 6.5 on the IELTS or 79 on TOEFL. No GREs are required, and students should hold a bachelor's degree prior to entering. For the next slide, Akash, we have our lab-based programs. Here we have 2 options that were introduced earlier, the thesis versus non-thesis tracks. So students who go to a thesis track will do a thesis project, and they can potentially join the PhD program at MCPHS afterwards. Non-thesis students can work in the industry as well with the same knowledge, but they would not be able to join the MCPHS PhD programs. However, you can apply to PhD programs outside of MCPHS that you qualify for. So you'll notice that the thesis track lab-based programs require a GRE, some with higher English test scores as well, 7.0 on the IELTS or 90 on the TOEFL. And all of these majors are STEM. So for the next slide, Akash, lastly, the Accelerated PharmD program, which was introduced, is 3 years long, spanning a fall, spring, and summer semester. And it does require students to do a list of prerequisites. So depending on what courses the student need, you may or may not need the Graduate Summer Studies program listed on the slide, which is a 10-week summer program that fulfills liberal arts classes just before the fall start of the Accelerated PharmD program. So if you're interested in any of these programs, the next step is to apply. Any student that has done their post-secondary education abroad will need to complete a course-by-course evaluation from WES or ECE. There's a letter of recommendation requirements, and English test scores mentioned, GRE for certain programs, and we encourage all students to apply as early as possible so they can work on other requirements, such as their student visa in the case that they decide to enroll. So thank you so much, and I will now pass it back to Lauren.
Lauren, can I just make a comment on the English scores before we go on? So as Janice mentioned, we have 2 sets of scores for English over there, right? If you look at the TOEFL scores, we have 79 if it's a non-thesis versus 90, which is a thesis. And I just want to clarify the reason for that. So keep in mind, if you're doing a thesis-based program, there's a lot of writing involved, there's a lot of reading involved, there's a lot of analyzing journals and journal articles. Because you have to write up a research proposal, you have to defend that research proposal, and then you have to actually write up your dissertation or your final thesis and defend that. And so we do want to see students who have some proficiency where they will be able to communicate, their thoughts as to what type of research they're doing it, why they're doing it, and why is it important for them to do. And so because of that, we require a slightly higher English proficiency for the research base. Thank you.
Thank you, Dr. Kerr. I think that was a really helpful overview for our students, and I know I was happy to hear it. So for those of you that are on the call, as promised, I had mentioned that we want to make sure that you are well informed when you're looking into different schools and different programs that you're interested in. So this is just a sample of some of the questions that we know are really important to the outcomes that you receive throughout your education and through your degree. I want to take a second to offer you a moment to screenshot this slide so that you can go back, and you will get the recording to this webinar as well, but that you can use this to better inform the decisions that you're making. So I know a lot of our student workers will be talking about how they interact with the faculty members at a very regular basis at MCPHS, which will highly impact their outcomes when both in their education, but also in their job outcomes as well. So these really should offer a strong base for you. And if you aren't familiar, if any of these intimidate you, or if you feel like I could ask these, but I won't understand the answers, please start researching them. Work with your university counselors to understand these. That's what we are here for. We want to help shepherd you through this process. So at the end of this, also, you will have a chance to scan a QR code and find out which one of us is your counselor. When you do that, you can bring these questions to us and we would be more than happy to discuss them with you. So Akash, if you could bring me to the next one. Thank you. So this is often my favorite portion of our webinars. This is where you get to really hear from the students that we have on the call today to talk about their experiences. So first, I'm going to start out with Alicia. So Alicia, could you please talk about your experience on how you found a research opportunity at MCPHS and in Boston? So how finding that opportunity looked like, and then also what that opportunity is. I know you mentioned it a little bit, but here's an opportunity for you to elaborate.
Thank you, Lauren. I would like to say that I'm working on a thesis-based project right now. So it was mandatory for me to do lab rotations that we offer at our university. So in the first semester, the students who are doing their thesis, they would be offered lab rotation, which is basically you do different you assist the professors and the current students in their own research work. So there are different professors you want to learn from. So you'll approach your professor and he may test you on some of his basics. So you just need to answer some basic questions, and he may take you as a student for his lab rotation, where you could interact with the senior student as well as the professor, and you do get an actual learning from the current project the senior student is working on, and you'll assist that student, and you can learn about how to design and experiment, how to analyze those results, and how to actually work on it. So this depends on different professors. The topics are different, the ideologies are different from when it comes to professor to professor. I did my lab rotations with 2 or 3 professors, and then finally decided on who my graduate advisor will be. So this is how you can learn about the different research opportunities from different professors. And one thing which I've learned from MCP is that collaboration matters a lot. Please look forward to different collaborations, whether it is some students, whether it is some faculty members, because over here everyone is looking forward to it, and everyone is going to be more than happy to welcome you guys. Whenever you go up to a senior student, he's gonna always guide you. And for example, if I'm going towards my senior for some, if I'm having any research doubts, or I'm having an experience to share, my seniors would always be welcoming, and so are my faculties. They would be more than happy to welcome me in their office during their office hours. So this is one of my advice, that please look forward to meeting your faculties as well as your senior students. This is how I landed into my research opportunity, and right now I'm about to complete my research, and I'm about to graduate by the end of the semester. Thank you.
That's great advice. Thank you, Alicia. So big takeaway, collaboration is key and network as much as possible while on campus. I'm really glad to hear that you had such a positive experience in working with faculty and our upper level students. So Sophie, can you take a moment and share with us how the rotations you've had at MCPHS in the Accelerated PharmD program have helped to prepare you to become a PharmD in the future?
Yes, we have a community and hospital rotation after the first year is done. So we just experienced like 1 month's hospital setting and the community setting. And after that, when we finish the second year of pharmacy program, we are starting our rotation. So it's a community, hospital, and a lot of settings, but you can choose your electives, such as industry, or home infusion, compounding. There are a lot of options you can choose. I chose the industry because I wanted to experience before, but I chose certain department which I've never experienced. So I met my fellowship preceptor and preceptors and the director of the department. So they taught me a lot of things and they gave me a lot of chance to share, and also I could attend a lot of global meetings at Novartis in Boston. So it was really a valuable experience for me. And then if you are interested in community or hospital setting, you can choose more options in that setting too. For example, I felt I'm not gonna like the hospital setting work, but once I started emergency department work as a pharmacist with my ER pharmacist, it was really interesting. And even though you don't set up your goal yet, you could find out what you like more during the rotation. And those kind of journey definitely help you to find out a good job, and you are gonna be a great pharmacist after graduation. And I believe so too. Thank you.
Thanks so much, Sophie. That's really great to hear. The next question I'm going to give is for Shivani. Could you please help students understand what supports we have on campus to help you getting research opportunities or internships?
Sure, Lauren. So, okay, MCPHS has a list of resources that are available for research opportunities as well as internships. So going in order, if we talk about internships which students usually pursue during their summertime or the summer break, I would say, which is a 4-month duration, there are various career services cells that are available, and one-on-one experience is given to each and every graduate student, wherein they are guided basically how to prepare their resumes and how to prepare for mock interviews. In fact, there are few faculties who I know that they conduct the interviews with students. And moreover, there is a system that MCPHS follows, which is a Microsoft Blackboard. And every month there are internships and research opportunities posted. Moreover, every year, MCPHS has a lot of collaborative workshops going on. I, in fact, participated in one that was done by Pfizer last semester, and it has been happening every year. So that is something which gives students really the exposure to the industry and how everything functions in pharma companies. And I think a lot of the ISA members who are here, Neha and Alicia, would have participated in the similar workshops. And talking about the research experiences, so specifically for those who are in thesis-based programs, they are very much exposed to the laboratories on a daily basis. And also there are tours done for the non-thesis based programs. They are taken to various industries. And as Dr. Kerr mentioned, that MCPHS is surrounded by a lot of medical facilities. So we have a lot of collaborative research projects going on. In fact, the one that I'm working on right now, a skin cancer, is actually a collaborative project with one of the other universities in the United States. So I guess in terms of internship and research opportunities, MCPHS has a lot of options and a lot of ideas to be cultivated and, just get into it, get to know what pharma company exactly is like.
That's great. Thank you so much, Shivani. So Neha, you had a unique experience where you started in the regulatory affairs program at MCPHS. And since then, we have introduced a new program called Regulatory Sciences, which is a STEM program. Can you explain why you decided to make the choice to switch from regulatory affairs to regulatory sciences?
Sure, Lauren, thank you. Actually, regulatory affairs is offered as either online or on-campus opportunity. When I was in Canada, I was considering not on campus, but taking this course online. But as Alicia mentioned, that networking and collaboration is really important. And as Dr. Kerr mentioned, that Boston is a hub for pharmaceutical companies, and there are a lot of opportunities to explore. As so far as transferring from regulatory affairs to regulatory sciences, regulatory affairs do provide exceptional knowledge on FDA approval, laws governing the drugs and medical devices, and quality system regulations. But when this program was introduced, Dr. Frank Hauser, he's the program director for regulatory sciences and regulatory affairs and health policies. He explained it to me, and we went through the advantages of transferring into a STEM. So regulatory sciences is a STEM program, so advantages of transferring into it. This STEM program will elevate my knowledge about determining the safety, efficacy, quality, and performance of the drugs and medical devices. It will clear my fundamentals about the pharmaceuticals in general. And the job prospect for regulatory people, especially after doing regulatory sciences, I would say it is phenomenally wide. Sky is the limit, especially in fields like biotech, doing research in biosimilars and pharmaceutical industries.
That's really helpful. Thank you. And the reason I wanted so badly for you to answer that question is because I'm sure there are students on the call who are both interested in regulatory affairs, but also want to do a STEM program. So Shivani, I'm going to send you another question. Could you explain what your plan is after getting your graduate degree? I know you had intended to continue your education, so can you tell us about that and what you plan to do?
Sure, Lauren. Yeah, so as I already mentioned that I'm working on a thesis project and it is related to skin cancer. So right now the molecule that I'm working on is actually not FDA approved. So it is a novel drug, and we are actually working on a formulation which has a chance of getting patented here in the United States. So I wish to continue my research first on that specific formulation, get the patent out. And once that thing is completed, I would like to get into one of the industries which is into this dermatological cancer research. And after gaining a year or two of experiences and just learning what exactly a pharma company demands and how a professional setting works actually, other than the laboratory one, I would also like to get into a PhD program so that I can, deepen my knowledge on how actually cancer is, because cancer is a very notorious subject to touch upon, especially at a graduate level. So I would definitely like to have a doctorate degree in it and understand how actually everything from the molecule works and advance more into the same field of research.
Just always so impressed by you, Shivani. Thank you so much for sharing your answer. So,
thank you, Lauren.
Of course. So at this point in our presentation, we've put a new slide on here, and we want to give you the opportunity to scan this and find out who your counselor is that you will work with at MCPHS. So you can scan this and use this information to find out what country you're currently living in, and based on the country you're currently living in is which counselor you will work with. So for instance, if you live in Canada, your counselor is Krista. If you live in India, you're looking at Mr. Akash Bablani right now. And for Latin America, or if you're living in the States but you aren't a citizen, it is yours truly. So at this time, I'm going to leave this up, and I'm going to start taking questions from our Q&A section. So if you haven't put questions in there and you did have more questions, please throw them in there. And I would like to start out by passing it to Dr. Kerr. I know you mentioned you wanted to answer a question live.
Sure. If there are questions out there, please.
Yes. So where can someone work with a pharmaceutical degree?
So the obvious answer is the pharmaceutical industry, obviously, but that's not the only place. You can go into government, in their policy department and regulating drugs. You can go into academia, become someone like me, if you like, a professor. So a pharmaceutical degree opens you up to actually many different types of opportunities. The major ones are, of course, the pharmaceutical industry, but also government regulatory agencies and academia. I would say those three are the top. Not to say that you cannot use that information and that knowledge to get into management type of programs, hospital management, and things like that.
Really helpful, thank you. And I'm going to pose another question to you, Dr. Kerr. We have a student who wants to understand what opportunities they can get with the pharmacology program. And they're also asked, I think, a really great question. What is the trend of international students getting a job in the pharma industry in the US?
So the opportunities for pharmacology, keep in mind, pharmacology is a relatively broad discipline because you could do animal pharmacology, where you work with whole animals, mice, and other types of animals. But then you can also do molecular pharmacology, where you're working with cells. So for example, as Shivani mentioned, cancer, drug research, you can actually do research using cancer cells, different types of lineages of the different types of cancers. But then you can also basically get a model, an animal model of that particular cancer, and do the animal study as well. So depending on that and the knowledge you have and the expertise you have, you could work in a pharmaceutical research environment, either on the molecular side or on the whole animal side. Not to say that you cannot then go on and work even in their regulatory department or in their safety department, because by having a degree in pharmacology, you pretty much have a good knowledge of drugs and their different actions. As far as international students getting job opportunities, as I mentioned, at least in the Boston area, and I would say also on the West Coast, and a little bit down in the Research Triangle area of the United States, which is North Carolina. These areas are the three major areas for biotech and pharma industry. And there are always opportunities at the research level where you can work in labs. Or if you want to get into management, then you may have to do a slightly other program to get onto the corporate or the management side. But from a research side, there are many opportunities for international students. And again, keep in mind, a degree in pharmacology is actually designated as a STEM program, that is a science, technology, engineering, and mathematics. And so once you get an opportunity to work in an industry on your foreign student visa, you can actually extend that opportunity to up to 3 years and get even more valuable experience.
Excellent. Thank you so much, Dr. Kerr. I'm going to pose this question to Janice. She has answered the direct student, but I think it is an interesting one. So we have a student who applied for regulatory science, but they're interested in possibly taking the NAPLEX. Could you answer that question, Janice, or what that looks like?
Yes, sure, Lauren. So in order to become a pharmacist, as we mentioned, students do need to do the Accelerated PharmD program. In that program, it prepares you for the NAPLEX, which is the licensure exam to become a pharmacist in North America, as well as giving you the rotational hours that you need that experience in order to take the exam. So with just regulatory sciences, it's not exactly the same area. You would need to go into the PharmD program to achieve that licensure.
And if I can expand on that, Janice, and just to mention to all of the people on this webinar, the National Association of Boards of Pharmacy, they only recognize the Doctor of Pharmacy degree. Okay, so in the US. So if you want to practice pharmacy in the US, you need a Doctor of Pharmacy degree, which is accredited. And then you are eligible to sit for the NAPLEX and the MJPE exam. Keep in mind, if you're coming with a pharmacy degree from another country, there is a way to do that through the Foreign Pharmacy Graduate Equivalency exam. but you would need to have a minimum 5-year degree program and to have been licensed in your country before you are eligible to even apply for the foreign pharmacy graduate equivalency exam. Once you complete the foreign pharmacy graduate equivalency exam, you will be authorized to get your internship hours, which can range anywhere from 1,500 hours to 2,000 hours, which you will have to do before you then become eligible to sit for the NAPLEX exam. So that is the only alternative way.
Really helpful. Thank you both. And this kind of goes along the same vein. So if we have a student who has an international PharmD, how should they go about their admissions process if they wanted to do our accelerated PharmD program? Janice, I was
yeah.
aiming that towards you.
I can take that one. So yes, students would need to go through the application process. We review to see what your coursework included, if it meets all of our prerequisite requirements. If you haven't, we work together on a plan to complete those prerequisites before you actually start the professional Accelerated PharmD program. So I'll leave my email out there in the chat if anyone wants to reach out to me with a personal meeting to discuss that personal plan for them.
Awesome. And then Neha, I see that you're typing this answer in the chat and you can finish that after, please. But if you could take a moment and discuss the core difference between regulatory affairs and regulatory science.
Yes, thank you, Lauren. So the core difference between regulatory affairs and regulatory sciences is first thing, Masters in Regulatory Affairs and Health Policies is a non-STEM program, which allows you to have 1 year of OPT after your graduation, while regulatory sciences is a STEM program, STEM designation, which allows you to have 3 years of OPT after graduation. Now, in regulatory affairs, Masters in Regulatory Affairs and Health Policy program, you get the general overview about the drug manufacturing process, medical device, the drug manufacturing, device manufacturing, regulatory filings into FDA to get approvals, quality assurance, quality compliances, laws governing the health of the human subjects that are involved. You learn about epidemiology, you learn about statistics, but the difference in education when it comes to regulatory sciences is that in regulatory sciences, you are given 2 or 3 core fundamental pharmaceutical programs, which will enhance your knowledge about the whole process of safety, efficacy, and how the drug is manufactured. So in this regards, your knowledge will broaden. You will have more clear understanding about the pharmaceutical world here in here in United States of America. So you will have also like CMC, chemical formulations, more in-depth knowledge about the biosimilars, IND applications. All those will be more in-depth towards the pharmaceutical part. And medical device would be medical device. Of course, you don't have to go to the formulation, but they will teach you in depth about the application to FDA for a new medical device application and approval.
Thank you so much, Neha. And I believe we had a follow-up question to this. So if you were applying to these programs, and this goes for any program, if you have international credits, you are going to need a transcript evaluation if you want your credits transferred into MCPHS. So a student had asked about the admissions requirements around those. That's an important piece to remember. We prefer the WES evaluation, that is course by course. And when I say WES, it's WES. And this again is required not only for regulatory affairs or sciences, but for any international credits that you want to bring into MCPHS. Regulatory science is a STEM program, and the deadlines to apply, we like to have our applications in by February 1st, but if you need an extension, you could reach out to your counselor and we can try to work with you on that. So this could be a question for Dr. Kerr, but if Neha wants to add in, that'd be more than welcome. What are the job opportunities after doing the regulatory affairs program?
Neha, you want to take that since you're
Sure, Dr. Karan, maybe then you can add with your more experience on that subject. So as a regulatory graduate from regulatory affairs, be it the STEM degree or the non-STEM designation, As I said, sky's the limit. You can work in any pharmaceutical or medical device industry. I personally aspire to go to medical device industry because my dentistry is background. My background is dentistry, and I have been dental office manager in Canada for 3 years. I have associated with many leading dental companies, and I find intriguing about how these new and evolving technologies are coming in respect to medical device industries and concurrently in the dental device industry. So as Janice also, Dr. Kerr mentioned, and Janice also mentioned that you can go into the veterinary clinic, or you can do pharmaceutical, biotech. Biotech is actually very up and coming. Biotech and biosimilars doing in regulatory field. So any drug approval or any medical device approval, if you want to get an approval from FDA, the company needs to have the FDA's guidelines to follow, and regulatory plays a big part in this. So as I mentioned, sky is the limit. Pharmaceutical industry, medical device industry, you can work anywhere, you name it. Dr. Kerr, if you want to add.
Yeah, sure. Thank you, Neha, for that. And I should also mention that, if you're thinking about biosimilars is something which is a very, what should I say, a hot topic, if I can use that term, because, protein drugs are the drugs, almost 90% of new drugs today that are being approved are basically biologics, protein-based. And as we all know, protein-based drugs are expensive to make. And so, the costs for these drugs are also pretty high. I mean, you're talking about a drug that could be, anywhere from $100,000 to maybe $1 million a year, which costs the patient. And so there is this tendency to try and bring down the costs. And one of the ways to bring down the costs for these brand name protein drugs is to make something what we call as a biosimilar. So a biosimilar is a similar drug to the protein that was brand name, but of course made in a different biotech environment, in the sense that maybe the cell expression system is different, or the cDNA that they're using have some slight modifications for stability or whatever. And so it has to still go through basically like an abbreviated new drug approval process. And so that's where the reg affairs come in, because if you have to go through an ANDA, you need to know the regulations, you need to know the sciences, you need to know the chemistry manufacturing controls. And so, there's a great need for people who have this expertise. So that's where I would say some of the opportunities would lie. I can also mention there are many so-called CROs, clinical research organizations, who do some of these filings of INDs and ANDAs. And so they also hire people with this knowledge. Thank you.
Thank you both so much. We are at 8 o'clock. We're going to do one last question and then close up shop. Shivani, we had a student who wanted to know, they are interested in mostly joining the pharma industry and working in research. Would a non-thesis program be more suitable for me than a thesis program? And if you could answer that in a minute or less, that would be great.
Yeah, of course. So if you want to work in research, then definitely thesis is more recommended. So industry basically has two branches when it comes to pharmaceutics. One would be the formulations branch, wherein you will be working as more of like a technician role, wherein you'll be just working with the equipment and already work on the formulations that have been established. Whereas industrial research is something else, wherein you develop your own formulation, you do all the research and development studies. So if you plan on working in the industry, but as a research scientist or as a formulation scientist, you need to go with the thesis-based program. But if you wish to work on already established formulations, you can go with the non-thesis one. And also, when you go with the thesis program, you're supposed to have a mentor or your graduate advisor selected, as Alicia mentioned. And if at any point during your curriculum you feel that you don't want to continue with the thesis, you can always have a word with your graduate advisor, and then if they permit, you can always switch to the non-thesis track.
Thank you so much, Shivani. So with that being said, I want to take a moment and thank Dr. Kerr for joining us. Thank you to our ISA panelists, our student panelists. and to my colleagues here on the call. And thank you all of the attendees for joining us, asking some really great questions and helping us have a great conversation today. We will send out the recording link within the next 24 hours. And again, you can screenshot this if you wanted to get in touch with us. We'd be more than happy to help shepherd you through the process and meet to talk about your more individual questions. So thank you, everybody. Have a great day or night, and thank you for joining us.
Thank you. Bye-bye.
Bye.